Is an IPG right for bladder nerve stimulation treatment? Imagine a tiny device under your skin that helps your bladder work better. That's what an implantable pulse generator, or IPG, does in bladder nerve stimulation treatments. It's a small, battery-powered device that sends gentle electrical signals to nerves controlling the bladder. This approach is called sacral neuromodulation and is used for certain bladder conditions that don't respond to other treatments. Bladder nerve stimulation with an IPG is mainly considered when conservative options like behavioral therapy, medications, or bladder installations haven't helped. It's often called a fourth-line treatment. The goal is to improve symptoms like urgency, frequency, pain, or urinary retention by modulating nerve activity. The process starts with a trial period, usually about a week, where a temporary device is placed to see if symptoms improve. If the trial is successful, a permanent IPG is implanted under the skin, typically in the buttock or lower back area. Many patients see significant benefits from this treatment. For example, those with overactive bladder or bladder pain syndrome often experience reduced urgency and frequency. About 45% of patients with urge incontinence become completely dry after nerve stimulation, and many others notice substantial symptom relief. For urinary retention, around 61% of patients no longer need to use catheters. Success depends on individual factors, including the specific bladder condition and previous treatments. However, like any medical procedure, there are risks. Some people may experience pain at the implant site, infections, or lead displacement, which might requiring additional surgeries. The device battery usually lasts 5 to 7 years, after which it needs replacement. Some patients might feel unwanted electrical shocks or notice changes in bladder or bowel function, which could mean adjusting or removing the device. Patients with neurological conditions tend to have lower success rates, often around 20 to 30%. When it comes to bladder cancer, the role of an IPG is limited. Bladder cancer treatments often involve surgery, chemotherapy, or radiation, which can affect nerve function differently. For survivors experiencing ongoing bladder issues or pain, neuromodulation might be an option if other treatments have failed, but this requires careful evaluation by specialists. It's important to rule out cancer recurrence or complications before considering nerve stimulation. In summary, an IPG can be a valuable tool for certain patients with difficult bladder problems. It offers a chance to reduce symptoms and improve quality of life. But it's not suitable for everyone, and careful medical assessment is essential. If you're considering this treatment, talk to a urologist or bladder health specialist who can evaluate your specific condition, discuss potential benefits and risks, and help decide if it's the right choice for you. Always remember, personalized medical advice from your healthcare provider is key to making informed decisions about your health.